We're here today with Dr. Michael Greger, who is the Director of Public Health and Animal Agriculture here at the Humane Society of the United States. Dr. Greger is a wealth of knowledge on all issues, well, animal and health. So I wanted to pick his brain a little bit, and I'm so grateful that you're here. Thank you so much.
Happy to be here.
Okay, so it drives me insane when I hear these people say, I don't eat carbs anymore because I want to lose weight. Can you elaborate on this?
Sure. So, I talk about some of these low-carb diets. And, the grain, quote unquote, right, no pun intended, the grain of truth is that it's these refined carbs, these processed carbs like table sugar and white flour are no good for us.
Right.
But just like anything, fat can mean Crisco or it can mean walnuts. Or, carbs can mean, kidney beans or, table sugar. And the same can say with protein. Protein can mean, bacon or it could mean, some lentils or something. Right. So, so it's really, it's not only carbs versus unprocessed carbs, but, unfortunately this kind of broad brush has been painted against carbs. And carbs can be, quote-unquote carbs can be some of our healthiest foods. Sweet potatoes are carbs, right? Legumes, beans, chickpeas, lentils, these are carbs. But I do encourage people to reduce their consumption of that kind of refined carb junk food.
Right.
But certainly one doesn't need to form a diet around bacon and butter to avoid some of the garbage out there.
Right. Now, I understand that what people do is they say, oh, I'm not going to eat any carbs, so I'm going to load up on protein. How can that get risky for your body?
Well, again, it's there are healthy sources of protein and unhealthy sources of protein. So there's protein in pork, just like there's calcium in dairy and iron in beef. But food is a package deal. Burger King says you can have it your way, but you can't go and I like the protein. Yeah, but hold the saturated fat and the hormones and the parasites and that. No, it all comes together.
Right.
And so, yes, you can get your calcium from dairy, but it also has, the butter fat and the antibiotics, the hormones, things you don't want. Whereas you get your calcium from dark green leafy vegetables, for example. Then the baggage that comes along with the calcium is the fiber and the folate and the phytonutrients and the potassium and iron, all sorts, all the wonderful stuff that you want in your diet. It's the same thing with protein. Okay, sure, you can get your protein from, a hamburger, but then you get all the saturated fat and all the stuff that you don't want, increasing your risk for a #1 killer heart disease.
Exactly.
Why not get your protein from legumes? We're the superstars of the plant kingdom. And then again, what do you get with it? All the good stuff without the bad. And so it's really the preferred source of protein because again, food comes as a package deal.
Now, doesn't eating too much protein tax your kidneys?
Yeah, you could really get very high levels of protein, and so, but it's not, protein, the studies have shown both, have been kind of mixed in terms of protein and kidney function. So Harvard researchers really figured it out when they were measuring dietary determinants of failing kidney function. They were measuring what's called proteinuria, loss of protein in urine. Not supposed to be losing protein in urine. When you do, it shows your kidneys are starting to fail. And the 3 risk factors they found, and only 3 risk factors they found for declining kidney function, was animal protein, animal fat, and cholesterol, all of which are only found one place, that's animal products. But note, it wasn't protein. Right? Plant protein didn't cause declining kidney function, specifically animal protein, specifically animal fat as cholesterol, as well as cholesterol. And so one really needs to differentiate. So then when we say, people eating low-fat diet versus high-fat diet, well, what are the sources of that fat? Same thing with high-carb or high-protein. By choosing whole plant foods, one doesn't need to worry about what percentage your calories are fat or what, we don't have to walk around with a calculator every day. We just have to choose whole plant foods, and it all takes care of itself.
Right. Now, this is kind of a technical question, because I have a girlfriend who goes on and off of these, no-carb diets.
Yeah.
And you know who you are. Anyway, she keeps telling me about how her triglycerides are so much lower when she's on this no-carb diet.
Yeah, sure.
Explain what triglycerides are, first of all, and then how is this sort of a mixed message, maybe?
Well, so when you eat refined carbs, your triglycerides shoot up, which is kind of these fat levels in the blood. It's the way your body kind of handles excess calories. And you eat a lot of refined carbs, particularly if you're sedentary, and your triglycerides can go up. It's kind of part of this so-called metabolic syndrome or prediabetes. But again, what's the answer? Oh, okay. Well, every time I eat, pastry, my triglycerides go up, so I'm going to have a hamburger. It doesn't make any sense, right? Because then your cholesterol go up. You get the best of both worlds by choosing non-refined carbs. So choosing whole grains, for example, right?
Mm-hmm.
Staying away from the white rice, white pasta, white flour, and instead choosing whole grain foods, and protect even better intact grains. And then you won't get the spike in triglycerides, and you won't get the spike in cholesterol in your blood, which can lead to a few of our leading killers.
Indeed. Now, you just mentioned pre-diabetes.
Mm.
That's a whole topic we could probably talk all day on. But can you tell me basically, like I'm a 4-year-old, what is diabetes? How exactly does it affect my body?
Yeah, so diabetes is the inability of your body to deal with sugar, deal with blood sugar. So normally, insulin is the signal that allows sugar to enter into the cells in our body. Mm-hmm. And if we don't have insulin because we're born with type 1 diabetes,
right.
We have a dysfunctional pancreas, we just don't make insulin,
Mm-hmm.
then with no signal to allow, with no key to unlock the kind of doors on our cells to allow the sugar to go in, we have really high blood sugar levels. And that can lead to all sorts of problems. These are the complications of diabetes, like loss of eyesight, loss of kidney function, you get amputations.
And that happens because the sugar is
and
breaking down the walls of our
the
blood
sugar,
vessels?
the sugars in such high, basically called glycates. It adds sugars onto our proteins and onto our kind of body structures, and they just don't kind of function as well.
Okay.
Now, type 2 diabetes, which is becoming more and more common, they used to call it adult onset, but now we're seeing it in kids these days, which is really tragic. And that is your body's resistance to insulin. So you're actually producing insulin, but the cells of your body are resistant to that insulin signal, and so again can lead to too high levels of sugars in your blood, which can have all sorts of kind of adverse consequences. And the reason why your body would become resistant to insulin is because we think it's what's called intramyocellular lipid, which is fat actually inside the muscles of our cells. When we eat a lot of fat, particularly saturated fat, we can kind of stuff fat inside of our cells, and for some reason, when the fat is stuffed inside of our muscle fibers, they don't respond to insulin as well. It kind of gums up the lock. So even though we have lots of insulin keys, the sugar's just kind of not getting inside. And so, but that can lead to real problems.
Yeah.
So the answer, we think, it's a sugar disease, so, diabetics shouldn't eat a piece of fruit or something. No, actually, what they should do is go on these very low-fat, plant-based diets. So you can actually reverse the disease. You catch it early enough, you can cure type 2 diabetes. You had it, you were on pills, you were on insulin, you go on a plant-based diet, and you can reduce your pills, you can reduce your insulin dose, and even get rid of these, and come back to normal fasting blood sugars. You can reverse this disease, which is one of our leading killers now, with a healthy plant-based diet.
Now, my boss, who has type 2 diabetes, he swears that he can still eat whatever animal fat he wants, as much fat as he wants, because his family members never had any problem with high cholesterol or high fat in their blood. How does diabetes affect and link to heart disease?
Yeah, the number one killer of diabetics, they still get amputations and lose their vision and go on dialysis, but the number one killer of diabetics is still heart disease. And so that's why it's particularly critical. So, everyone needs to eat healthy to prevent our number one killer, heart disease, for both men and women. But diabetics have to be particularly careful and have to eat exceedingly healthy, not only to reverse their diabetes. Does your boss want to have diabetes for the rest of his life? And what does he want to die from? And number one killer of diabetics and number one killer of everyone, heart disease, there's only one diet that's ever been proven to actually reverse heart disease, open up arteries without drugs, without surgery. In the majority of patients, only one diet ever proven. What's that diet? It's a plant-based diet, right? Ornish showed it in 1990 with his low-fat vegan diet and other healthy lifestyle changes. Esselstyn's since proven that. And so, when anyone comes up to me with some newfangled diet, and they're all the time, and they say, what about this diet? I may have never even heard of this newfangled diet. There's just so many of them. I said, well, has it been proven to reverse our number one killer? If that's shouldn't a plant-based diet be the default diet, the fact that it can reverse our number one killer, that should be the default diet until proven otherwise. And the fact that it can also reverse hypertension and diabetes and obesity, some of these other leading killers, this is just kind of the bonus that comes along with it. And so, I mean, until that happens, then, I mean, we shouldn't be on any other diet, but the healthiest diet we know. The balance of scientific evidence clearly points to a plant-based diet as being the healthiest.
Well, and that's one of the reasons why I wanted to have this conversation, is because I think it's so important. If we all know what's going on at a very fundamental level, we can help each other. You know, I should care about the fact that my boss has type 2 diabetes.
Sure.
I should try to take care of him. And I think that the more people who know about what this disease is doing and how we can prevent it, we can all try to help each other out, and just as a society, you know, just have less suffering, as you said.
People don't know. I mean, people just simply don't. The doctors don't know, first of all. And we're just not taught in medical school. I mean, we just don't know that we don't have these tools at our disposal. And so, I mean, too many doctors these days are just kind of stuck with, you know, kind of managing chronic disease, not making people better, and just kind of piling on pills and kind of slowing down the progression of disease, trying to prevent some of these complications. But, I mean, that's not very satisfying. You went into medicine because you want to help people. But no, but now there's this entire field of lifestyle medicine. There are now tools to reverse chronic disease, actually get people healthier than they've ever been. And it's possible, and it's all been surrounding not only exercise and stress reduction, and smoking cessation, but most importantly, diet.